Well, when you think of all the changes that they must be experiencing, they've been removed from probably very familiar surroundings, their home environment, and now they're in this strange environment. I think if any of us have ever been in the hospital, we can relate to how that feels to just be removed. It's very scary.
Even on vacation, you know, in somebody else's home, it's more stressful. So what we can do, particularly in a new situation like that, is make this place that they're now living, the CBRF, look more like their home. Have the family bring in furniture or the bedspread they're used to and pictures from home and things like that, reducing their stress and therefore reducing their anxiety and therefore reducing their confusion. Many times we think, oh my gosh, this person really is confused. The family didn't tell us about it. And it could be just that now they're under a lot of stress. They're not used to having so many people around them. Something else that can cause symptoms of dementia that we can fix is pain. If people are in pain, they're often, particularly older people, maybe confused or irritable. Many of us, when we have pain, are irritable. And we can maybe prevent the pain, and if not prevent it, at least be aware of the fact this person has pain. And probably a really good example is older folks have a lot of chronic pain associated with arthritis. And if you hurt all the time, you might be real distracted, not paying attention when people are talking to you, and could be assumed to be demented, when in fact all you are is hurting. So if we could talk with a doctor and maybe treat that arthritis pain, then maybe they'll be more comfortable and not as demented. Another form of pain is constipation, and that's why it's important that we record when people are having bowel movements, that we provide nutritious meals with fiber in them so that they do have regular bowel movements, and we can avoid that pain of constipation.
I remember my grandma always had a bowl of prunes every morning.
Right, and so she was preventing dementia. People who have hearing and vision loss are often misdiagnosed or mislabeled as being confused, when in fact they just may not be seeing well, or they may not be hearing well. So it's real important that older people wear their glasses, that they have eye exams, so that they're seeing as well as they can. It's important that their hearing aids work, that they have batteries in them. It's important that we slow down when we're speaking to them so that they can understand us. We have to recognize that this is part of the normal aging process, and it'll probably never be as good as it was when they were younger, but we can help them be less confused if we compensate for the losses they've got. Other things we have to think about with reversible dementia is that when people have, particularly older people, have a serious illness, whether it's diabetes that they live with all the time or they're coming down with the flu, one of their first symptoms may be confusion or irritability. We don't want to assume that this person is getting demented, that they have an irreversible problem, when in fact it might be something with treatment can be made better. A good example might be diabetes. You know, somebody's sneaking food from one of the other residents, or the family's bringing in food that they're eating. And we need to be alert for those kinds of things. When we see confusion, we need to think what else might be happening here.
I think that's such a message of hope that you as a caregiver can make a difference by possibly reversing some of these horrible symptoms of dementia. It's real important, too, that we recognize medications can cause symptoms of dementia, confusion, withdrawal, sleepiness, agitation, whatever. And we need to make sure that the doctor knows all the medication the person is on, so that they aren't counteracting each other or potentiating each other, making them act stronger than they really are. Because we can change medications, we can lower the doses, we can change the doses, we can change the medication and make the dementia symptoms go away. Something real important here that we need to talk about is depression. A lot of older people actually have depression, which is a treatable disease, and they're mislabeled as having something like Alzheimer's disease. And that's unfortunate. The symptoms of depression look so much like Alzheimer's disease in the early stages. It interferes with their thinking ability. Maybe they'll be less independent. They sort of withdraw and need people to take care of them. They've experienced a lot of losses, and so this is fairly common in older people, but we can fix it. Why don't you tell us a little bit more about irreversible dementia? Okay, I'd be happy to. Well, as I mentioned earlier, Barbara, irreversible dementia is the type of dementia that can't be reversed or can't be necessarily helped, or the person can't be brought back from the damage they're having. I'd like to tell you about some of the things that cause irreversible dementia. You mentioned the small strokes. These can also cause a type of dementia that is progressive, that does get worse. And this type of a dementia is called multi-infarct dementia. As you said, there's many different long words associated, and that's not so important, but it is important to know that this irreversible dementia is caused by many, many strokes, and is progressive, does worsen in a person. It also, this irreversible dementia can be caused by a severe stroke or a major stroke. It can be caused by severe infections, and I'd like to give you a couple examples of those infections. One might be called encephalitis, and that's an infection that happens inside the brain, causes kind of a fluid buildup within the brain. Also, infection is AIDS, and that's become very prevalent. We see many people affected, and that can cause, in the end stage of AIDS, irreversible dementia, or those dementia-type symptoms we've been talking about. And then finally, there are some diseases that cause irreversible dementia, and a couple of the more popular ones are Parkinson's disease. We've seen that affect some celebrities. Of course, Katharine Hepburn is another famous person that we see. And the other popular disease that causes irreversible dementia is Alzheimer's. And of course, we see some celebrities affected by that, and probably the most notorious is President Ronald Reagan, who's now affected by Alzheimer's disease. It's important for you to know that all of these diseases are diseases of the nervous system. They do affect the nervous system within a person. And in most of these nervous system diseases, the physical changes will be noticed first. As we see with Parkinson's, we see the kind of the shuffling of the feet and a little bit of the tremors and that sort of thing. But as the disease progresses, we see the loss of mental abilities, and we also notice in the later stages, as I mentioned, that loss of mental abilities. Alzheimer's disease is the most common form of irreversible dementia, and it actually accounts for 50 to 60% of all of the types of irreversible dementias. So you can see that's quite prevalent. And as you're going to talk about next, Alzheimer's disease has a gradual beginning and gets worse with time. And will you tell us a little more about that?
I'd be glad to. Alzheimer's disease attacks the brain and results, like we've been saying all along, talking about dementia, it will result in impaired memory, impaired thinking ability, difficulty communicating, and that's not just me talking to you, but also what I'm hearing from you, how I understand your words and respond to your words. And it also affects judgment, and usually judgment is impaired with Alzheimer's disease. We hear a lot of people having the diagnosis of Alzheimer's disease, and people often wonder, how does the doctor come to this conclusion? What's real important, and we need to stress to everybody, is that the doctor goes through a process of eliminating other things that could be causing the symptoms. Some reversible things like we've been talking about. It's not an automatic diagnosis. The doctor, you don't want to take someone into the doctor who says to you, well, she's 80, what do you expect? It's probably Alzheimer's. It certainly could be, and the older this person is, the more likely it is, but it also could be something else. And until we've ruled out something else, we don't want to make any assumptions. The damage that occurs in the brain and what they see at autopsy are called plaques and tangles, and I believe on the screen right now will be some pictures of this as I'm speaking. They're hallmark signs, and when they see these in the brain tissue after death, they go, aha, it was Alzheimer's disease, we were right. What happens in this disease is the brain cells get sick and they die much more rapidly than normal. We all lose brain cells every day as part of normal aging, but with Alzheimer's disease we lose them much more rapidly. The connections break down between the cells so that the cells can't communicate with each other. The ones that are left, try real hard, but they can't communicate the way they should, and so they can't compensate for the ones that they've lost. And then it's another thing that's real important to know is that the chemicals that help the cells communicate with one another are called neurotransmitters, and some of those are lacking. There's not enough of those, so that even that is impaired. Even that doesn't work right, and the few cells that are left, again, can't communicate because those chemicals aren't there. There's going to be on the screen right now a cartoon of what the brain would look like if we could look inside of it, which of course we can't do while we're alive. But this particular cartoon shows extension cords within the brain. And I always think of Christmas trees when I see this particular slide, because if you had a Christmas tree and somebody tripped on the cord, what would happen to the Christmas tree?
Well, your lights would go out.
Right, the lights would go out, and that's much like what happens in Alzheimer's disease. It's like somebody's pulled the plug and the lights go out in that particular part of the brain.
I think sometimes families even say that to us, that it looks like the lights have gone out. They look in the person's eyes and they just don't see that spark.
Right, it's just not there.